Hey guys, my name is Dr. Cameron Murphy. I'm an orthopedic spine surgeon for OrthoVirginia in the Northern Virginia office. I did my training, my med school and residency in Augusta, Georgia, at Medical College, Georgia, and then my fellowship in Los Angeles at Cedars-Sinai Spine Center. Today we're going to talk about disc replacements in the spine. Who is a candidate? This is going to be a two-part series. So today we're going to talk mainly about disc replacements in the neck or the cervical spine. Then I'll come back in a couple months and talk about disc replacements in the low back or the lumbar spine. So what we're going to talk about today, some cervical spine anatomy, some cervical spine problems that I treat. We're going to talk about what is a cervical disc replacement, who is and who is not a candidate, and I'll take some questions at the end. So for some anatomy, the cervical spine has 7 vertebral bodies between the base of the skull and the chest, and that allows your neck to move. And so this is a front view. You can see the vertebral bodies in the middle with the pink disc spaces in between, and the yellow are the nerves coming out from the spinal cord to go to the arms. And again, this is the front view. This is on the left, a side view. And so not only do you have the vertebral bodies in the disc in the front, but you have these triangle-shaped bones on the sides, the left and the right side, called the facet joints. And those in combination with the discs in the front allow the spine to move. And so an analogy I like to tell patients about is a tricycle with a big wheel in the front and then 2 small wheels in the back. And then that is the structure of the spine, but there's some other important areas. I call them some nerve tunnels. And so you have 3 tunnels, one being a large tunnel in the center of the spine where the spinal cord lives, and then a tunnel on the left and right side where the nerves go through and exit to go to the arm. And so we'll talk about some common things that patients have that come to me. And the first one is cervical radiculopathy. So this is called a pinched nerve. It's pain and numbness that travels along that nerve from your neck into your arm. And the location of the pain depends on which level and which nerve is pinched. And so higher up in the cervical spine, you have more pain in the neck and shoulder areas. Then as you come down in the spine, you can have pain that goes down your arm and into your hands. This is most commonly from injury or breakdown to the disc, and this causes disc herniations and bone spurs. And this breakdown, you can imagine, if you get bone spurs and herniations, it can go into the tunnel where the nerves live and pinch that nerve and cause pain. So again, this is called cervical radiculopathy. The other big issue that I see is called cervical myelopathy. And you can think of this as a pinched spinal cord. And so these patients present much differently than people with cervical radiculopathy. And so they have issues with balance. They feel off steady when they walk. They have difficulty using their hands. So things like buttoning buttons and fastening jewelry is difficult for them. They drop things, and overall their hands just feel very clumsy and don't work right. Again, most commonly, this is from the same process that causes cervical radiculopathy, which is injury and breakdown to the disc. But these disc herniations and bone spurs, instead of pushing on the nerve tunnels on the sides, the left and the right, it pushes on the main tunnel in the middle where the spinal cord lives and compresses that spinal cord. So what is a cervical disc replacement? So it's a very common treatment for both of the things we just talked about: cervical radiculopathy or a nerve pinch, and cervical myelopathy or a spinal cord pinch. And what we do is we go in through the front of the neck, we take out that diseased or degenerated disc, we shave down all the bone spurs that push on the nerves in the spinal cord, and after we're done with that, a space is left between the 2 vertebral bodies. And in that space, we put an artificial disc that allows the spine to move and promotes and preserves the motion of the spine. And so one of the biggest questions patients ask, and what we talk about in clinic, is why do a cervical disc replacement versus a fusion? So in contrast with a cervical disc replacement, a fusion, the first part of the surgery is exactly the same. We go in through the front of the neck, we take out the disc, we shave down all the bone spurs, we decompress or take pressure off the spinal cord and the nerves. But instead of putting a spacer in that still moves, we secure it with plates and screws, and that kind of attaches or stiffens the 2 vertebral bodies between there. This is a great surgery. Or fusion in the front of the neck is a great surgery. It works very well. We've been doing it for many, many years. But the concern is that as you stiffen one segment of the spine, it puts pressure on both the level above and level below. And this can lead to further surgery if those levels break down. So I do like cervical disc replacements because, like we talked about, the spacer moves And this preserves motion in the spine and it protects the health of the rest of the spine. And recent studies have shown that people that get cervical disc replacements have better outcomes in terms of neck pain and neck function, and are less likely to need another surgery in the front of the neck. So who is a candidate? So patients with what we just talked about, disc degeneration and breakdown in either a pinched nerve or a pinched spinal cord. And this is after failing and trying all conservative treatments. So things like physical therapy, medications, and injections. And so my goal is to have people avoid surgery if possible. And if they fail the non-surgical management, so I can fix it with surgery. And that's how I would treat my family members. So who is not a candidate? So patients with both disc and problems with the two facet joints in the back of the spine. So back to the tricycle analogy, if you have all three wheels are broken, and you just replace the wheel in the front of the tricycle, it's still not going to work correctly. And so the same thing can happen in the spine. If you have a problem with the disc in the front and also the joints in the back, and you just replace the disc, you're going to continue to have pain in those joints in the back, and patients are not very happy. And one thing I hear all the time is that the spine disc replacement is the same thing as a joint replacement, like a hip or a knee replacement. This is not the case. In a hip and a knee replacement, you replace the entire joint, all new surfaces, all new. This is not the case in the spine where we're just replacing the disc. There's no technology out yet where we can replace everything. Other people who are not candidates are people with too much breakdown or collapse of the disc. When this happens, we have to take out too much bone with decompressing or taking pressure off the nerves, and that does not allow the disc replacement to work correctly. Other people who aren't candidates are people with severe osteoporosis or poor bone quality, and people with instability and deformity. And so my ultimate goal is to help people stay active, whether that's with or without surgery. And I do think a cervical disc replacement is a good option for a lot of people. I see patients in Haymarket, Ashburn, and Stone Springs, and I'm happy to see anyone at those locations at any time. And now we're going to take some questions.
Thank you so much, Dr. Murphy. So we will be answering questions that are submitted live right now, as well as some questions that were submitted earlier. Not all questions will be able to be answered, but we will be answering as many questions as possible. So our first question is this an option with severe arthritis?
So it depends. It depends where the arthritis is. Like we talked about in that tricycle analogy, if the severe arthritis is both in the disc and in the joints in the back, a disc replacement is not a good option. It's only going to treat the disc problems and leave you with pain in the back of the spine. But if your severe arthritis is just at the level of the disc and it's not too collapsed, then yes, a disc replacement still is a good option.
Thank you. Is there an age limit for a disc replacement?
This also depends. So age, in my opinion, is just a number. So I see some patients who are 80 years old and look like they're 50. And so I take that into account. The FDA initially designed the disc replacements with the trials to be done in patients under 65. But again, I take that into account, and depending on how healthy you are and how you look, not just the number of the age.
Thank you. How long does the disc replacement last?
So we don't know for sure on this yet, but studies show that at 20 years, the revision rates or the issues with the disc replacements are 1% to 2%. And so the disc replacements haven't been around for forever. So they came out in the early 2000s. And so we know they can last up to 20 years, but we won't really know what the final number that they last until time goes by.
Thank you. Does commercial insurance or Medicare generally cover disc replacement?
So in general, insurance will cover 1 to 2 level disc replacements. And sometimes this depends on your insurance. And there's always things we can do to work with you to help insurance cover these.
Thank you. What is the recovery time and what does recovery look like?
So as far as I'll talk about kind of what the surgery looks like. In most cases, if it's a 1 or 2 level, you go home the same day. For the first 2 weeks, I just have you take it easy with weight restrictions of 10 pounds. From 2 to 6 weeks, you can kind of increase your activities. And with the weight restriction of 20 pounds, I get you into PT at 6 weeks with the goal of being completely back to normal by 3 months. but you're feeling much better, usually at the 4 to 6 week mark.
Thank you. Where in the spine can you have a disc replacement?
So it's called the subaxial cervical spine. So from C3 to C7 are the most common places where you can have a disc replacement.
Can a disc replacement be done if you have a spinal cord stimulator?
So in general, yes. If you have a spinal cord stimulator, this is not going to limit you from having a disc replacement, but the conversation has to be had on why you have the spinal cord stimulator, why that hasn't worked. And we have to make sure as a joint decision that the disc replacement is going to help you. And so that goes into kind of me meeting you and talking to you and what your problem is, imaging, and all that kind of stuff to go into and to make sure if we do the disc replacement that you are going to get better.
Thank you. Can lost mobility be recovered after surgery?
So yes, a lot of these patients who have cervical radiculopathy, the pain is so bad in their neck and the arms that their mobility is decreased. And after the surgery, if that nerve pain goes away or is treated, you can gain a lot of that mobility back. But again, it depends on why you have that mobility decrease in the first place. If it's from the nerve pain, then definitely.
I know we're focusing on cervical spine today, but is it possible to have a disc replacement in other parts of the spine? A few people are asking.
Yes. So there also are lumbar disc replacements. These have some similarities to cervical disc replacements, but they also have a lot of differences. And so that's why I chose to have that discussion for another day, because it gets a little bit complicated and more things go into that. And so I'll be back in a couple months and we'll talk about the patients who can have lumbar disc replacements, why I do them, and things like that.
Is this a good surgery if you have compression fractures in your spine, either untreated compression fractures or ones that have been treated with, for example, cement?
So this is one of the issues where you do not want to do a disc replacement, because a disc replacement relies on very strong bone in the structure of the spine. And so if you have a compression fracture, this limits that strength and can cause the disc replacement to fall apart. So in general, I would say if you have a compression fracture, you are not a good candidate for disc replacement. However, if this compression fracture was many years ago and was treated well and your bone is still strong, then sometimes we can still do a disc replacement. But like I said, in general, that's usually a contraindication or a reason not to do a disc replacement.
Thank you. Will a disc replacement correct numbness in the arms, legs, hands, or feet?
Yes, so it depends where the numbness is coming from. If the numbness is from one of those nerve pinches, the cervical radiculopathy like we talked about, and I decompress the nerve and take the pressure off the nerve, that numbness eventually will go away. If the numbness is from another reason that we don't understand, then it's not reliably going to go away with disc replacement. But in general, the whole point of the disc replacement is to decompress the spine and the nerves, or take the pressure off the spine and the nerves and treat the nerve pain and numbness.
If there are cages, screws, rods, anything like that's been previously put into your spine, can you still have a disc replacement in a different part of the spine?
Yes, as long as that hasn't caused too much breakdown around that area. Obviously, if you have cages and screws and rods at one level, you can't do a disc replacement there anymore because that level is healed and fused. But if the level above breaks down or the level above needs surgery, that's definitely something that you could do a disc replacement for.
How long do you do physical therapy, medications, injections, etc., before you do disc replacement?
So a minimum of 6 weeks. I like to try non-operative treatment. So that's physical therapy and medications, sometimes injections. A lot of these disc herniations and issues, your body is going to try to heal them. And so if I can give your body time, your body absorbs a disc herniation or kind of treats that pain on its own, and you can avoid a surgery. So I wait at least 6 weeks, depending on how painful the patient is, sometimes longer. Sometimes injections, you get one injection and it lasts for a couple months, and that's great. And if the pain comes back, then we talk about either another injection or maybe doing surgery at that point. But I really try to give your body a chance to help you avoid a surgery.
If the symptoms have been going on for a long time, like a decade or more, will a disc replacement still help?
So that depends. So things like nerve symptoms that have been going on for a long, long time usually take a long, long time, even after surgery, to improve. But if the pain is from a nerve pinch and it's something that we see on the MRI and it matches your symptoms and we know we can decompress that nerve, I think it's worth doing a disc replacement or surgery in general to help that. But you have to understand that if you've been having that pain for 10 years, it's going to take much longer, even after surgery, for that to get better versus if you're having the pain for 6 months.
Can you describe what material the disc replacement is made out of?
Yeah, so this depends on the company or the type of disc replacement. There's 6 or 7 different options that the FDA approves for disc replacements, but they're a combination of some kind of metal, cobalt chromium or titanium, and a plastic bearing surface, similar to a hip or a knee replacement.
I have a unique question here, which is what happens to the sawdust when you shave down that bone spur?
Yeah, so we use drills and burrs and all kinds of tools to take away those bone spurs, and it does create a lot of what you call sawdust. And so we remove that with irrigation and suction, and so it's not in the area that we put the disc replacement. We take all that stuff out. It's a nice fresh surface for the disc replacement, so it can heal.
Are multi-disc replacements, replacing many of them at the same time, recommended, or is it better to just do one at a time?
So it all depends on the person. If you have cervical radiculopathy or myelopathy at multiple levels, you can do a multi-level disc replacement. The FDA and insurance usually only approves up to 2 levels. So that's the recommended kind of use of the disc replacement.
All right. Thank you so much. That is all of the time that we have for today. Would you like to close?
Sure. So again, thank you everyone for coming. It was great talking with everyone. Again, I see patients in Haymarket, Stone Springs, and Ashburn, and I'm happy to see you guys for anything at any time for your neck or your lower back.